In becoming a GSRtDCs therapist, we require that you get the basic license either by passing the diplomat course or by being grandfathered in, and then you get a year after being grandfathered, you get a year to pass the test. You get a provisional license for a year. So there's an awful lot of work that needs to be done for you to understand the 33 different chapters and the 33 different processes of all the different things that are involved in having a license in biofeedback, an international license in biofeedback.
Yes, why not get an immune license? Why not get an international license in biofeedback and GSRtDCs therapy? It's time to come for our industry to get together. And oh yes, Skio Indigo people, you can do the GSRtDCs therapy as well. The Quantum Super Learning Enhancement technicians, trained and licensed.
To get into the specifics of doing the GSRtDCs therapy, first we want to explain just what that is. It's galvanic skin resistance on transcranial DC direct current stimulation.
Yes, this electrical potential has been shown to increase osmosis and to have positive effects on the brain. Now we use a ground on the leg for even better, more universal brain enhancement.
This is we've been doing since 1973 in a host of different ways, and we have full license and registration to do this. This has been found to enhance intellect as well as sports performance. Now the procedure of doing it, after you've done the SOC in the machine, you'll be given an opportunity to do the pre and post EEG and ECG. On the first visit, you should do the EEG and the ECG on a before and after your total session. This will give you an idea of what type of problems there might be in the brainwave.
If you have the eductor, you'll be able to do an EEG or an ECG or both in a pre and post test to help you to get insurance payment and for further validation verification. If you have a Skio or Indigo, you can still do all these functions.
Once you've done that, inside the program, during the function of your first test, you need to go to the EEG page and do the EEG analysis to see just what you might find. If you find slow waves or other things, you keep treating them until you get the normal. Keep treating those things until you get the normal. This type of procedure is taught to you in the regular license program. Once you've stabilized the EEG and you've done a pre-test, and then you've done the stabilization, when your total session is over and you do the post-EEG, you should see improvements because the machine will have stabilized part of the EEG, as it would have done with the ECG or the GSR or EMG. Now, during this session, you do your normal type of session with the test and you do your normal type of procedure. And then after about 30 minutes or so on your first visit, you want to do 15 minutes on the first visit of at least super learning therapy. To do the super learning therapy, you need to make sure that the big is operative. You want to go to one of the therapy sessions inside the computer. I'm showing you a couple of those that I prefer now. Pick a nice normal therapy that would help, one of the super learning therapies. And one of the best places to go to it is through the NLP. And you get into the NLP program, turn on the system, go to the second waveform generator if you have the eductor, as you can see here on the screen. And as you're doing this, go to the big, and put in a movie, and you want to use one of the super learning movies that you get on the hard drive. The hard drive has a whole bunch of different high resolution, high memory super learning movies that help to enhance the patient ability with different types of sacred geometry shapes hidden in the system, motivational qualities, vibrational sounds, solfeggio frequencies, and a host of other different things that help to intensify the super learning therapy done by the eductor, Skio, Indigo, or whatever you have. As you do this and you go into the big screen with the biofeedback page, you'll be able to see that the machine is working on voltage and amperage and resistance, as well as all the other factors of the VARHO to help make the patient's body electric better. You do this procedure for 15 to 20 minutes minimum on the first visit. As in addition to the total other therapies that you do as normal with a normal type of SCIO, educt, or visit, and then you can be able to make a report of a pre and post, and sometimes this can even be used for insurance company repercussion, third-party payment. However, that doesn't always work, but that's up to the patient because you can give them a super bill, and then you can charge them directly for your therapy. On the subsequent visits, because we want to make a 5-visit contract, 5 visits to be done within a 2-week period maximum. This has a value of $200 per visit, meaning $1,000 for the full session, 5 sessions. And we're going to offer a reduction price of $650 at the beginning of the year, September and October, to help people to afford this. And this will be a special price. Now, on the additional visits, if there's no reported problems, you don't need to set up anything. You can go from calibration straight into the big, and you can do a 30, 40, or even 55-minute session on super learning with the person because the machine is going to autofocus. During this time, you should be trying to monitor them in some fashion. Keep an eye on them because they might have a vasovagal reaction. That happens when the autonomic nervous system switches too fast from sympathetic to parasympathetic or backwards. They would start to sweat. They might get a pain in the belly. They might get nausea. They might get a pain in the eyes. All these different things, and they might even pass out and faint. You should try to have some cold water to put on the eyes, cold rag, maybe on the back of the head or on the eyes. That helps to get them out of it if it happens. If it should happen, you want to take off the system, gradually talk to them, and usually subsides in 15 minutes. If it doesn't, let them sit until it does subside, and it will gradually subside within 30 minutes maximum. Help keep an eye on them while they're having this problem. And this is a very, very rare problem, but you need to be prepared for it as proper licensed technicians. Then you can hook them back into the system, and usually without any problem, or maybe you might reschedule for another day. But as you monitor them, you should also be sitting there observing their different traits, if they have twitches, if they're uncomfortable with themselves, if they have attention difficulty, all these other things that you should be able to discuss. Now, as a GSRtDCs therapist, everything that's on this website, you are responsible for. All of these PDF texts you need to read and know. You will be tested on all of these different material because you need to know about the super learning foods and the diets. You need to learn about this, what supplements to take and what not to take. You need to know about all the different factors, the history, the procedure, and most importantly, you need to know about the validation verification of the research. If people ask you questions, you need to be able to tell them where to go to get answers if you can't answer them yourself. And if you've been able to do all of this and get down to the system, you're going to learn and understand how to help these people, how to help children enhance their scholastic abilities. The test will be waiting for you, and if you have questions, you can get to me and I can help you. I will be developing a sample video to show you how I do this with patients, and I hope that this all comes together for you so you can understand. This is GSRtDCs signing off.